If you're a man over 60 and still want a healthy, functional penis, stop and listen. I'm Dr. James Ellison, a board-certified urologist with over 30 years of experience helping older men protect their sexual health, confidence, and independence. Most men think problems down there are just part of aging, but in reality, many are caused by simple, preventable mistakes. In this video, I'll reveal 10 things you should never do to your penis after 60. Habits that can lead to erectile dysfunction, infections, and even cancer. Make sure you watch until mistake number 10, because it's the most dangerous and most common one I see.
Kids, let's begin before we dive in. If you haven't subscribed yet, go ahead and click that button and turn on the notification bell. I share straightforward, no-nonsense health advice, made especially for men over 60. And if you find this video helpful, type 1 in the comments, if not type 0. I genuinely want to improve and bring you content that matters. All right, let's get into it. Starting with one of the most overlooked yet powerful signs your body gives you, your erection. It might surprise you, but your
ability to get and maintain an erection isn't just about sex, it's about survival. It's often the first signal that something deeper is going wrong in your body, especially with your heart and blood vessels. Let's break that down. 1. Never ignore your erections. I'll tell you something I wish more men heard earlier in life. Your erections are not just about sex. They are a vital sign, just like your blood pressure, your vision, or your heart rate. How your penis behaves is your body talking to you, and when you're over 60, that message can be a matter of life and death. I've had patients walk into my office thinking that weaker erections are simply a part of getting old. They laugh it off or shrug saying, "Doc, it's just not what it used to be." But when we run tests, we often find something deeper: high blood pressure, clogged arteries, even undiagnosed diabetes. In fact, studies show that erectile dysfunction can appear years before a heart attack. Think about that. Your penis might be giving you a warning. Your heart hasn't spoken yet. One man I'll never forget was in his early 70s. He came in for a routine checkup and hesitantly mentioned he'd been struggling with erections for about a year. "Just stress," he said, but we did a few tests, and within weeks he was diagnosed with coronary artery disease. He was able to get treatment, and he's still around today to enjoy his grandchildren. He told me, "I thought I came in because of a bedroom issue. Turns out my body was saving my life." I want to be clear. Occasional performance issues are normal. We all have off days, but if you consistently notice a decline in morning erections, arousal, or performance, don't brush it off. It's not about ego. It's about circulation, hormone balance, nerve function, and emotional health. All of those systems are connected to your ability to have an erection, and if one of them is off, your penis is often the first to notice. The good news is addressing this early doesn't just improve your sex life, it could quite literally extend your life. So don't wait for things to get worse. Talk to your doctor, ask questions, get checked. It's never too late to take control of your health, because while an ignored erection may seem like a small thing, what it's trying to tell you could be the biggest thing of all. Now, what if I told you that one of the most dangerous threats to your penis is something men often do to try to fix it? Let's talk about that. Next, if you're still here and this message is resonating with you, drop a number 1 in the comments so I know you're listening. Your engagement means a lot. Now let's keep going. It's time for point number 2. 2. Never use home remedies or unproven devices. This is a tough one to talk about because I know it comes from a place of desperation. I've seen good, intelligent men, hardworking husbands, fathers, veterans turn to the internet late at night, searching for answers when things stop working the way they used to. When you feel like less of yourself in the bedroom. It's tempting to try anything that promises a quick fix: pills, oils, creams, stretching techniques, homemade devices, all promising miracles without effort. But I'm here to tell you, as someone who spent over 3 decades treating men's health, these shortcuts can ruin you. I once treated a man in his late 60s who tried a vacuum pump he found online. He was too embarrassed to come in right away, so he waited until the swelling, the bruising, and the pain became unbearable. By the time he showed up, his tissue was badly damaged. It was heartbreaking because his only mistake was trying to help himself, but he chose a path without guidance, and he paid the price. There's also gelling, a technique that spread like wildfire across forums and YouTube videos. The idea is that repeated stretching will make your penis longer or thicker. But I've seen what it actually does. It tears delicate tissue, leads to scar formation, and in many cases causes long-term erectile dysfunction. And the worst part, most men, some, who use these techniques never tell anyone, not until the damage is done. The truth is, if something sounds too good to be true, especially when it comes to sexual health, it probably is. There's no shortcut to reversing the aging process. No secret herb that adds inches overnight, and no piece of plastic from a DIY website will ever replace the guidance of a trained medical professional who actually cares about you and your future. I understand how vulnerable this feels, the silence, the fear, the frustration of wanting to feel normal again, but please don't trade hope for harm. Talk to someone. Get a proper diagnosis. Let's solve the right problem the right way, because the worst thing you can do to your penis isn't just ignoring it. It's thinking you can fix it in the dark alone without real help. And speaking of hidden dangers, let me ask you this. When was the last time you actually checked? Really checked under the hood? What you don't see might be putting you at serious risk. Let's get into that. Next 3. Never skip hygiene. But don't overdo it. I know hygiene isn't the flashiest topic, but let me tell you, I've seen more problems in my clinic caused by either neglect or overcleaning than you'd ever expect. It's one of those things that seems so simple, and yet when it's not done right, it can lead to discomfort, infection, and in rare cases, even something far more serious. I once treated a retired truck driver in his early 70s. Tough guy, spent decades on the road. He came in with a red, irritated rash on his penis and said, "Doc, I wash it twice a day, I don't get it." And that was the problem. He was scrubbing with strong, heavily scented soap, even using a loofah. His intentions were good, but he was damaging the delicate skin, stripping away protective oils, and creating the perfect storm for irritation and infection. The skin of the penis, especially under the foreskin. If your uncircumcised is sensitive, it doesn't need to be scrubbed like a dinner plate. Gentle warm water, maybe a little mild unscented soap and a soft towel to pat dry. That's all it takes. If you're uncircumcised, you must pull the foreskin back and clean underneath. Letting moisture and bacteria build up, there can lead to something called
balanitis, an inflammation that can be painful, itchy, and in severe cases led to scarring, or even difficulty retracting the foreskin at all. But on the other end of the spectrum, there are men who avoid touching themselves altogether, often out of embarrassment or outdated cultural shame. That silence, that reluctance to even look, is dangerous. I've had patients who went years without realizing something was wrong, simply because they never took the time to inspect themselves. I'm not saying you need to be paranoid, but I am saying you need to be familiar with your body. Know what's normal that way. If
something changes, redness, swelling, discharge, or even a small sore, you'll catch it early before it becomes something far more serious. Your hygiene routine doesn't need to be complicated, just consistent and respectful. Treat your body like something worth caring for, because it is. Now imagine this. You do everything right. You clean, you check, you even follow up with your doctor. But one day you feel a sharp pain or notice blood where it shouldn't be. What do you do next? That's exactly what we'll talk about coming up if you're still watching, and these insights are hitting home for you. Go ahead and comment the number 1 below. It lets me know you're here and engaged. All right, let's keep moving forward with point number 4. 4. Never dismiss pain, bumps, or bleeding. There's something about being a man, especially growing up in earlier generations, that teaches you to tough things out, push through the pain, don't complain, don't make a fuss unless it's unbearable. I get it. I really do. But when it comes to your penis, silence and delay can cost you more than your pride. They can cost you your life. I'll never forget one patient. A quiet man in his late 60s who came in after his wife finally convinced him to get checked. He'd noticed a sore on the head of his penis months earlier, maybe longer, but it didn't hurt much at first, so he ignored it over time. It grew still. He waited, too embarrassed, too afraid. When we finally diagnosed him, it was late-stage penile cancer. We did everything we could, but he needed surgery that forever changed his life. And the truth is, if he had come in when he first noticed it, we might have caught it early enough to treat it, simply even preserve everything that mattered to him. Pain, sources, bleeding. These are your body's way of waving a red flag that doesn't mean it's always cancer or something terrifying. Sometimes it's an infection, a sexually transmitted disease, or even a kidney stone. But if you see blood in your urine, feel burning or discomfort, or notice an unusual bump or sore that doesn't heal, do not wait. Don't tell yourself it'll go away. That voice that says, "It's probably nothing," isn't a doctor. It's fear wearing a mask. And let me be clear, no good doctor is going to judge you for coming in. We've seen it all, and we're here to help, not shame you. Whether it came from sex, an old injury, or something you can't explain, the sooner we know, the more options we have to protect your health and your quality of life. Your penis isn't just about intimacy. It's about identity, confidence, and control. It deserves your attention and your action. When something feels off, because sometimes the difference between a minor procedure and a major surgery is just how quickly you pick up the phone. And now that we've talked about listening to the warning signs your body gives you, let's shift gears. What if I told you that even when things feel great in the moment, you could still be doing damage without realizing it? That's what we're diving into next. 5. Never have rough or uncontrolled sex. Let me be honest with you. I've seen a lot of things in my career, but one injury that always hits a nerve both literally and emotionally is a penile fracture. Yes, it's exactly what it sounds like, and yes, it happens more often than you'd think. Even, and especially in older men who are trying to prove they're still in their prime. One of my patients, a 64-year-old widower who had recently started dating again, came into the emergency room late one night, pale and shaking. He had heard a loud pop during intercourse, followed by immediate pain and swelling. He thought he could walk it off at first, but within minutes, his penis looked bruised and bent. What we call an eggplant deformity, that pop. He heard that was the tearing of the tunica albuginea, the tough membrane around the erectile tissue. A penile fracture isn't just a scare. It's a surgical emergency. Here's what I want you to know. Sex after 60 can be deeply fulfilling, both physically and emotionally, but trying to perform like you're 25 without adjusting for where your body is now can backfire. Rough thrusting, risky positions, lack of communication, they can all lead to injuries. And when your erection is at full rigidity, it's more vulnerable than you think. You don't need to be fearful, but you do need to be mindful. The solution isn't less passion, it's more awareness. Use good lubrication. Take your time. Communicate with your partner if you feel yourself losing control. Slow down. You are not in a race. This is about connection, not performance. And remember, the quality of your intimacy improves when you feel safe, relaxed, and confident, not when you're pushing past your limits to prove something. And while we're on the topic of control, don't underestimate how important it is to protect the health of your entire reproductive system, not just your penis, because sometimes the things that feel warm and comforting, like a hot soak or a sauna, might actually be doing more harm than good. Let's talk about why keeping your testicles cool could be one of the smartest health moves you make. 6. Never overheat your testicles. It might sound strange at first, but one of the simplest ways to protect your sexual health as you age is to keep things cool. Literally, your testicles weren't designed to be packed in heat all day. There's a reason they hang outside the body. They need a slightly lower temperature to function properly, and yet most men don't give this a Second thought, I remember one gentleman, a 68-year-old retired teacher, who came to see me about fatigue, low libido, and what he described as a foggy mind. He assumed it was just aging, but after some blood work, we found his testosterone levels had dropped significantly as we talked through his lifestyle. One habit stood out: hours each day, soaking in a hot tub and resting his laptop directly on his lap. He had no idea that this constant exposure to heat could be affecting his hormone levels and fertility even in his later years. Now you might be thinking, fertility at my age? But it's not just about making children. Your testosterone affects your energy, mood, muscle mass, bone density, and yes, your ability to maintain an erection. When your testicles are constantly overheated, sperm production drops, and over time, so can your natural hormone production. Modern life isn't helping: heated car seats, tight underwear, long hours of sitting, and yes, laptops and smartphones resting right near the groin. They all add to the problem. The fix doesn't mean living in an ice bath. It just means being mindful. Use a lap desk or a pillow under your laptop. Avoid sitting in hot tubs or saunas for long periods. Choose breathable underwear. Make these small shifts, and your body will thank you for it. I know it's easy to brush off little habits like this, especially when they're part of your daily comfort. But the little things add up. Heat might feel good on sore muscles, but when it comes to your reproductive health, too much of it is working against you quietly, steadily, over time. And speaking of pressure, not all of it comes from the outside. Sometimes the biggest threat is the pressure we put on ourselves in private moments. Let's talk about a habit many men don't even realize is harming their sexual health. You may be doing it and not even know the damage it's causing. 7. Never use a tight or aggressive grip during masturbation. This is a topic that rarely gets talked about, and when it does, it's usually wrapped in awkward jokes or silence. But we need to be honest, because the way you handle your body when you're alone can have a real impact on how it performs with a partner. And yes, that includes how you masturbate. I had a patient in his early 70s, divorced for years, and living alone. During a regular visit, he finally opened up. He said, "Doc, I just don't feel anything during sex anymore. I get hard sometimes, but it just doesn't feel the same." So we started asking the right questions. What we discovered was something I've seen too many times: years of using a very tight, fast, intense grip when he masturbated. That grip trained his brain and his nerves to respond only to that specific kind of stimulation, not to the warmth, rhythm, or sensation of being with another person. We call this the death grip, and it's more common than you think. It's not about how often you masturbate, it's how. If you're gripping too hard, rushing through the experience, or doing it in complete isolation from emotional or physical connection, your body starts to learn that this is the only way to feel pleasure. And that's a problem when you find yourself with a partner, but the old tricks don't work anymore. Masturbation shouldn't be a guilty, rushed, or forceful act. It can be part of a healthy routine, especially as you age, but it needs to be gentle, mindful, and most importantly, similar to the kind of stimulation you'd expect during intimacy. Use lubricant, slow down, breathe, allow
yourself to experience the moment, not just escape it, and please don't carry shame about this. We grew up in a culture where men were told to hide their needs and never talk about them. But silence creates confusion. And confusion can lead to habits that hurt you in the long run. The good news is that you can retrain your body. You can shift how you respond, but it starts by treating yourself with care, even when no one's watching. And while we're on the topic of things that quietly destroy sexual health, there's one habit that does more
damage than any other, and it's completely legal, socially accepted, and incredibly addictive. Let's talk about it next. 8. Never smoke and start moving again. If I could give just one piece of advice to every man over 60 who walks through my clinic doors, it would be this: quit smoking right now, not next month, not someday. Right now, I've seen more lives, more relationships, and yes, more erections lost to cigarettes than to any other habit. One of my longtime patients, a former Navy mechanic in his late 60s, once told me, "I quit drinking. I quit red meat." But those cigarettes, they stuck with me like an old friend. The problem was that old friend was killing his sex life. He came in frustrated, saying his erections were weak and unreliable. We ran the tests. His cholesterol was high, his circulation was poor, and his arteries, including the ones that lead to the penis, were narrowing. And guess what was at the root of it all? Decades of smoking. You see, your penis is like a pressure system. It needs strong, steady blood flow to fill and stay firm. Smoking damages blood vessels, hardens arteries, and reduces the ability of blood to flow freely. Over time. That damage builds up, and by the time you feel the difference down there, it's already well underway elsewhere, often in the heart, the brain, or the lungs. But it's not just about quitting a bad habit. It's about replacing it with something good. Moving your body, even just a daily walk, can do wonders for your circulation, your testosterone, and your confidence. You don't need to become a gym rat, you just need to move. I've seen men in their 70s who never lifted a dumbbell in their life regain their energy and sexual function simply by adding 30 minutes of
walking and light resistance training to their routine. And when you move, when you sweat, when you treat your body with care, it responds, it heals, and yes, it performs better in the bedroom. You might think it's too late or that the damage is done, but it's not. Your body has an incredible ability to bounce back. If you give it the chance, the hardest step is the first one. But once you take it, everything else starts to shift. Now, you've probably heard the phrase mind over matter, right? Well, what if I told you that when it comes to your erections, your mindset could be either your greatest ally or your worst enemy?
Let's talk about that next 9. Never shame yourself for performance issues. If there's one thing I wish I could take off every man's shoulders, it's the quiet weight of shame. I've seen that weight in their eyes. Men in their 60s, 70s, even 80s sitting across from me in the exam room reluctant to speak up. Not because they're in physical pain, but because they feel like they've lost a part of themselves, like their ability to perform has slipped, and with it, their sense of identity, their pride, maybe even their worth. One patient, a 72-year-old former firefighter, put it like this: "Doc, I ran into burning buildings without flinching, but now I can't even look my wife in the eye." His voice cracked when he said it, and I told him what I'll tell you. You are not broken. You are not less of a man because your body has changed. You're human. And this is a part of the human experience, one that deserves compassion, not punishment. The truth is, every man experiences changes in sexual function as he gets older. Sometimes it's physical blood flow, hormones, nerve sensitivity. But more often than we talk about, it's psychological. One bad experience leads to fear, that fear leads to overthinking. Then performance suffers again, and the cycle tightens before you know it. It's not your body holding you back. It's the story you're telling yourself. Breaking that cycle starts with grace, with forgiving yourself for not being 25 anymore, with realizing that intimacy is about more than just performance. It's about presence, connection, communication. When you stop measuring your worth by what your body does in one moment, you start giving yourself the space to feel, again, to enjoy again, to connect again. Talk to your partner. Let them in, and if it feels like too much to carry alone, talk to a counselor or therapist who understands men's health. You don't have to suffer in silence, and you don't have to figure it out alone. Now I want you to think about this. What happens to a muscle that never gets used? It weakens it, shrinks it, forgets how to function well. The same principle applies to your penis. So what does that mean for your future health? Let's wrap this up with something every man over 60 needs to hear. 10. Never stop having erections entirely. There's a saying you've probably heard: use it or lose it. And when it comes to your penis, it's not just a cliche, it's science. I can't tell you how many men over 60 have sat in my office and said something like, "Doc, I haven't really had an erection in a long time. I'm just not that interested anymore." But what they don't realize is that those natural erections, even the ones that happen during sleep, aren't just about sex. They're your body's way of keeping things working. When you stop having erections regularly, the tissue in the penis begins to change. It can start to lose elasticity. The blood flow decreases, scar tissue can form, and yes, over time that can lead to actual shrinkage. Not a myth, not exaggeration, real measurable loss in length and function. What's more, your brain starts to turn down your sexual response simply because it's no longer being used like any system in your body. If you stop giving it a reason to stay active, it starts to slow
down. I once worked with a man in his late 60s who'd gone nearly 2 years without any sexual activity, not even solo. He had assumed it just didn't matter anymore. But then when he met someone new and wanted to reconnect physically, nothing worked the way it used to. The frustration he felt wasn't just physical. It hit his confidence, his self-worth, his sense of connection to the person he cared about. The truth is, maintaining erections, whether with a partner or through masturbation, plays a role in keeping the penile tissue oxygenated and
healthy. It's like giving it a regular tune-up. And beyond that, staying connected to your own sexual energy can help maintain your sense of vitality, intimacy, and emotional closeness, especially in long-term relationships. This isn't about pressure to perform. It's about permission to stay engaged with a part of yourself that never stops mattering, no matter your age. So if you felt yourself pulling away from that part of your life, ask yourself, is it because you truly don't want it, or because you've been telling yourself it's no longer allowed? And now that we've walked through all 10, the things you should never do, let's take a moment to talk about what you can do, starting today, to protect your health, reclaim your confidence, and keep living fully. The final word is one you don't want to miss. Final thoughts. If you've made it this far, I want to take a moment to speak to you. Not just as a doctor, but as a man who's walked through these same seasons of life with thousands of patients, many of them just like you. Men who've worked hard their whole lives, raised families, faced setbacks, and quietly carried their own questions, fears, and doubts about
their changing bodies. I see you. And more importantly, I want you to know this. You are not alone. And it is never too late to care for your health, your confidence, or your quality of life. We've covered a lot. We talked about how erections aren't just about sex. They're a barometer of your overall health. We looked at the danger of home remedies and DIY fixes and why proper hygiene, handled gently and consistently, can prevent serious problems. We unpacked the importance of listening to your body, especially when something doesn't look or feel right, and why safe, controlled, or sex matters more than ego. We discussed how too much heat harms your hormone levels, how even private habits like a too tight grip can impact your intimacy, and why smoking is one of the most damaging things you can do, not just to your heart, but to your manhood. We talked about shame, about the quiet, corrosive self-doubt so many men carry when things stop working the way they once did. And we finished with something I hope sticks with you, the importance of staying engaged, of not shutting down that part of yourself, just not way. Because you've reached a certain age, because sexual health isn't about youth, it's about connection, it's about energy, it's about being present in your life, in your body, and in your relationships. Maybe some of what you heard today surprised you. Maybe it made you reflect or even feel a little uncomfortable. That's okay. Growth often starts in the places we don't want to look. But I promise you, this taking even one small step in the right direction, calling your doctor, changing a habit, having a conversation can open the door to better, can open
health, more confidence, and deeper connection. You deserve to live fully, to feel good in your body, to be informed, empowered, and proud of the man you are at any age. And if you've been waiting for permission to start, consider this. Now's the time. If this message spoke to you today, if even one part of it made you stop and think, I encourage you to take a moment and give this video a thumbs up.